Good morning, everyone. Today I wanted to talk to you about something that I see in clinic all the time. In fact, this is something that is becoming increasingly common these days for a number of reasons. So, the topic is heartburn, as you can tell from the topic. And I've got a little friend here who's going to help us a little bit with the anatomy. So, there's a couple of ways of approaching heartburn. One is the standard thing that you might get in the doctor's office, which is okay, I've got heartburn. Here's a handout on things to do and avoid, but here's also some pills. The most common pills that are given are what are called the proton pump inhibitors, or PPIs. That includes Nexium, Protonix, and that sort of thing. You can actually get these now over the counter in the form of Prilosec over the counter, or OTC. Now, that category of medication, yes, it can be very helpful for heartburn, and it does have a purpose, especially when people are having a lot of problems. And the downsides of those medications, though, are in the past few years we've discovered increasing problems with them. They tend to thin the bones so that over time, women who have them over a long time have high rates of hip fractures and things like that. Also, it increases the risk of troubles with the lower intestines, such as higher rates of getting basically certain types of diarrhea, especially C. difficile diarrhea. Also, it's been linked with increased rates of Alzheimer's and dementias, and now it's been linked with increased rates of heart attacks. So these medications, although they do have a place in medicine and although they are incredibly useful for many people, we try to avoid using them for a long period of time and at the shortest or lowest amount of dose that's needed to control symptoms. There's another medication called Zantac, which can also be helpful. Protonix and Nexium, those pills, those proton pump inhibitors, they take 3 days before they really kick in. So sometimes I see people that say, oh, I just take my Nexium when I have heartburn, and then they wonder why it doesn't work so well, whereas they could take a Zantac, also over the counter, or a Tums, and it works relatively quickly. So anyway, of course, as you know, I'm a big fan of foods and using food as medicine to help prevent diseases. And one of the things that is very important to know about heartburn is that it can be really, really related to the foods that we're eating. Especially high-fat foods and sodas are very, very causative of heartburn as well. Now, why would that be? Well, that's why I've got my little friend here to help us out here. So the lungs, the heart, and the stomach. So the esophagus is behind all of those. So if you don't mind, I'm going to reveal the esophagus to you. Sitting there nicely behind the heart. So swallowing tube goes down, and then it takes a turn and it goes over to the stomach. I'm going to move the liver out of the way for a second so we get a better view of the stomach. My liver. Alrighty. And so basically the swallowing tube goes straight down, and then it kind of takes a turn a little bit to the side where it goes through the diaphragm to where the stomach sits underneath the diaphragm. And at the top of the tube and at the other end of the stomach, basically there are two little, we call them sphincters in medicine. So basically it's a tight circular muscle that kind of clamps down up here, and at the other end of the stomach it clamps down over here. So this is the esophageal sphincter, and this is the pyloric sphincter. Name doesn't matter, but just know you've got a bag of stomach which turns to digest your food, and you don't want that food leaking back up to the esophagus, so you got a little bit of a tight muscle to keep it in the right place, and you got another muscle at the bottom end that kind of keeps it in the sac. So what happens when you have chocolate, raw onions, peppermint, high-fat foods, especially things like fried foods and such? Well, basically it causes the body to open up that sphincter. So instead of having a nice tight sphincter right here into the at the top part of the esophagus, or its top part of the stomach, basically it loosens up, and now what happens is the acid can splash up the esophagus and basically cause those symptoms of heartburn as the acid goes up the esophagus and sometimes all the way up to the mouth, causing that funny taste in the mornings for some people. So, some things that are particularly causative of this, you can find these lists in many, many places, such as the MayoClinic.org, FamilyDoc.org, and so forth. Nutrition Facts, Nutrition MD, of course, have articles about this as well. And some of the things that are particularly causative are, as I mentioned, the sodas, coffees, the high-fat foods, egg yolks and meat, believe it or not, actually can be opening of that sphincter and cause that acid reflux to go up. Also, alcohol and tobacco. Now, the reason why those are especially important is because in folks that have been long-term tobacco users, and especially if you've had a high pattern of alcohol over the years, it really raises the risk of esophageal cancer by a lot. Also, certain drinks such as orange juice can be very acidic to the stomach and cause the acid to splash up more than other drinks might. So there's a big difference between eating an orange and drinking the orange juice. If you have an orange directly, it has a lot of fiber and a lot of other things in it that kind of slows down the absorption of that orange material, the acids and everything else, and it does not have quite as risk of the heartburn as the orange juice, where you remove most of the fiber. Foods that are very protective against heartburn. So you might know about those sparkling waters that are very popular these days. Those actually can be helpful for preventing heartburn. If you use a sparkling water which has a lemon juice or something in it, be careful, because a lot of the flavorings that are very popular in these, they're acidic themselves and can potentially trouble the tooth enamel or soften the enamel of the teeth. High fiber foods in general are very, very protective against heartburn. So people who have a lot of fiber in their diet, 30% lower risk of heartburn than people who have very little fiber in their diet at all. Green tea tends to be very protective as well, and sometimes probiotic style foods such as a soy milk yogurt that contains lactobacillus casei, for example. Alrighty. Now, another thing that's important about heartburn, besides the discomfort and the annoyance and the pain, is also one of the risk factors that's associated with acid reflux. So if somebody's got a long-term acid reflux that's not been treated, that's not been prevented by foods and so on and so forth, well, all that acid going up the esophagus and irritating that lining can lead to a higher risk of Barrett's esophagus, which is a precursor to the dreaded adenocarcinoma. In other words, esophageal cancer sometimes can be a result of long-standing untreated heartburn, which is another reason why it's very nice to get rid of it so you don't have it in the first place. So things that are also lower risk for that cancer include, again, high fiber intake. So the more fiber you have, at least 30% lower risk of adenocarcinoma. Nuts, beans are particularly protective. Beans are good for pretty much everything, but they also help with that as well. Your very antioxidant-rich foods. Green tea is very rich in antioxidants, for example. And the ones that were most protective against esophageal cancer were your dark orange veggies. So in other words, your carrots, your sweet potatoes, foods that are naturally high in vitamin A. They did some studies where they gave people pills that contained some of these antioxidants and things, and they had absolutely no effect on the risk for cancer, whereas when they had the actual food, it had a very protective effect. A couple other things, berry juice. There's been some studies on strawberries and raspberries against esophageal and mouth cancers that have been protective. Apples and, again, citrus. So the difference, again, between eating your orange and drinking the orange juice, eating the oranges can be helpful for protecting against the esophageal cancers as well. The things that raise the risk of esophageal cancer, besides the heartburn long-term itself, includes the meat products. So red meat, we know, also raises the risk for colon cancer, but it also raises the risk for esophageal cancers as well. And poultry, such as chicken, turkey, and so forth, increases the risk of cancers, not quite in the esophagus, but at the top of the stomach as well. So generally speaking, the more fruits and vegetables, whole grains, whole grain bread, that sort of thing that you have, the lower the risk for not only the heartburn, but also the esophageal cancer that sometimes can be a result of long-standing heartburn. One last note of things, that basically as our population in general has gotten heavier, so many more people are overweight or obese now than everywhere in the past, and that's got a big effect on our risk for the heartburn as well. So as you might notice, the stomach is, again, like a little pouch here, and it's supposed to kind of sit right underneath the diaphragm there. And what can happen is when people are, one, constipated and really straining and trying to push that stool down, it causes some pressure, and it basically causes this stomach, which is supposed to sit neatly underneath your diaphragm down here. Basically, the diaphragm does have a hole in it so that the esophagus can go down, and then the stomach just sits underneath there. So when we're straining at the stools, the stomach can sort of kind of start pouching up over that. That's called a hiatal, Latin for stomach, or maybe Greek, hiatal hernia. So basically hernia means that opening where it just kind of pushes itself through. That causes a lot of problems with heartburn. Also, when people tend to be a little bit overweight or a lot overweight, that also has a kind of a pushing effect, and it tends to push the stomach up higher, and also causes more acid splashing and acid reflux and that sort of thing. So another benefit of a whole food, plant-based, low-fat, no added oil diet is that it tends to cause people to lose about 10 pounds a month on average, roughly, if they need to lose weight. And basically it cuts down on that straining of the constipation. It also cuts down on the pushing upward of the stomach, that also is a major trigger for the heartburn. So these sorts of things don't happen overnight, and they do take a little time to improve. However, with improved diet, exercise, lifestyle, things like that over time, and using the latest in food sciences, this is a preventable and very, very treatable condition. So anyway, hope my little stomach model and my helpful anatomic friend here have been helpful for you, and hopefully this presentation will help you to have less heartburn in the days and years coming forward. Take care. Thank you.